Cost of healthcare. Hello everyone, and welcome to another entry to My Philippine Diary. Today we'll be discussing the cost of healthcare, doctors, and hospitals in the Philippines. We'll start out by examining my personal cost. On a monthly basis, I spend 1,500 pesos or $30 a month on medicines only. The medicines that I'm required to take are metformin. A box of that, 100 pills, cost me 175 pesos or $3.50 US. That's a generic version of glucophage. It's something that diabetics need. Next is naproxen. Naproxen is like ibuprofen, but longer acting. I have arthritis and that really helps my joints when I take that. A box of 100 of those cost 850 pesos or $17 US. On occasion, my ankles swell and I'll take a water pill to get rid of the excess water. One of those pills cost $1.20. I take that back. One of those pills cost 6 pesos or 12 cents, not $1.20, 12 cents. I also like to take a vitamin specialized for men who are over 50 years of age, and a month's supply of that costs 350 pesos or $7. One of the optional things that I like to keep in my medicine cabinet is something called POW. It's a liniment pain reliever. It's found here in Asia. Costs 149 pesos or $3 US. It works really well, but it smells really bad. If you're going to be around the house all day, it's okay to put that on. But if you're going out in public, you probably don't want to put that on. I like to have access to antihistamines if my hay fever acts up, and a pack of 10 antihistamines costs 60 pesos or $1.20 US. When I do visit a doctor's visit costs 500 pesos or $10 US. For Filipinos, that cost is $6 or 300 pesos. They do and are allowed to charge Americans a little bit more, so they will charge an American or foreigner anywhere from 350 pesos to 500 pesos for a doctor's visit. I don't mind paying a couple of extra dollars. During that doctor's visit, the doctor might require a series of blood tests, and that usually costs 350 pesos or $7. He might require an EKG. That costs 350 pesos or $7. He might require an ultrasound. That costs 350 pesos or $7. In general, my doctor's visits cost around 850 pesos or $17 US. If I'm back in the US, my monthly medical expenses are $281 a month, and that would be health insurance and co-pays, and then the medicines that I use on a monthly basis. I might add, when I was last working and paying for my own medical insurance, I didn't have diabetes, so diabetes being called a pre-existing condition on medical care in a medical situation would make my payments go up. So I'm fortunate that I didn't have diabetes when I was there in the States, so I would have paid more than $281. Actually, I priced insurance after I got it so I could buy some for myself, and it was more than $500 a month with a $5,000 deductible. Next, let's touch on a dentist. A visit to the dentist for cleaning usually costs me 1,000 pesos or $20 US. An extraction costs 1,000 US pesos or $20. Or filling costs 1,000 pesos or $20 US. If we were in the province or a smaller region of the Philippines, that cost would be considerably less. But because we're living in the big fancy city, Angeles City, things are more expensive here, and that's why we pay all of 1,000 pesos or $20 for a tooth extraction. My wife has gone to the neighborhood clinic for various medical needs, and the clinic here is free, but on her last visit she needed an antibiotic, and that was 410 pesos for a week's supply of 21. Roughly about a year ago, my daughter was very ill, and she was throwing up a lot. She was projectile vomiting. And so we had a decision to make. Would we take her to a clinic? Would we take her to a public hospital? Or would we take her to a private hospital? We settled on a private hospital. We took her and put her in the hospital. She stayed one day. That was 10,000 pesos or $200 US. That included doctor's fees, the private room, all the meds, the lab test. That private room came with a refrigerator, internet, cable TV, couch large enough for us to take a nap on, Wi-Fi, an electric tea coffee maker so we could serve ourselves tea coffee, extra nursing attention, air con, and a huge room. Oh, and one other thing, premium food that was better or not available to the people staying in the public rooms. Okay. The cost of rooms are as follows, or were as follows. A public room or ward cost 800 pesos or 16 US dollars and would have up to 10 people in that room, 10 clients, 10 patients. A semi-private room would cost 1,200 pesos or $24 US and would have 2 patients. A private room would cost 2,500 pesos or 50 US dollars, and of course there would be just one person. Let's have a look at that private hospital.
It's done, almost. Just relax. We're done.
And there you have it. Part 1 of medical cost in the Philippines. That's another video entry into my Philippine diary. Don't forget, like, subscribe, and share. Thank you very much.